Well, joining me now is Dr. Finical of Charlotte Plastic Surgery, here to discuss a liquid rhinoplasty. That sounds so interesting. What is that?
Well, fillers have become so popular in the last few years that we know over the last 10 to 15 years that they're safe and effective. And so we're using them in other areas. And the nose has just been the latest really rendition in that. The liquid nose job is essentially adding a filler to the nose to create a better bridge.
Okay.
Like everything else, there's a trade-off. There's upside and there's downside. The upside is it's an office procedure. It can be done very easily in the office. It can be done safely. And the nice thing with the modern fillers is they're reversible. We can inject an enzyme and it can go away if you really don't like it.
Oh.
The other downside is that it actually goes away. Well, so if you do like it, unfortunately, it goes away.
So it's not a permanent?
Correct.
Okay.
And that really is a problem. The real downside is it goes away. It has to be used for very specific indications to get a nice result. And it can only add, it can't subtract. So if somebody has a big nose, it can't make it smaller.
Got it. So do you still, when we think about the liquid, do you still have to, quote unquote, go under the knife? So is there a faster recovery? And
it's an in-office procedure, so we don't even use the fillers themselves have anesthetic in it. So it's a needle stick and just an injection.
Okay.
Has to be done very carefully. You have to go to somebody experienced. If you're interested in something like that, there's a lot of information on our website, which is www.charlotteplasticsurgery.com.
So who would be a good candidate for a procedure like this?
Good candidates are people that have either a subtle hump or a very low takeoff to their nose. So somebody who has a little indentation up there, we can put in a little bit of filler. It kind of camouflages a hump and gives them a little central portion to the nose. The other thing are people that have a very flat bridge of their nose. We can build up that bridge, and oftentimes it makes a real subtle but very, very nice appearance, makes the eyes look closer together, sometimes makes a person look more sophisticated.
Okay, so is this, not how many people have been coming to do it, but has this become a more popular rhinoplasty?
It certainly has become more popular, and it's a way for some people to test drive what they would look like with a little bit of facial change.
Okay.
So again, it's not permanent, but it can be something that somebody can take a look at it. If they don't like it, it can be reversed. Most people really like it if it's done correctly, and it can be done safely, and that's the important thing.
Well, awesome. And again, you know, just to remind you of something you said that I thought was very important, that you want to make sure that you get someone who is certified to do this. You don't want to just go out and have anyone do it.
Right. You want to have somebody who's been trained to do the injections, and you also want to make sure that they've done this type of injection before. This gets a lot more specific than you know, most of the injections that we do, and to do it safely and put the filler in the right place, you want to go to somebody who's experienced.
All right. Well, thank you so much for coming, and we really enjoyed hearing about that. It was something I hadn't heard of before. Guys, we have much more coming up on Good Day Charlotte, so stick around.